I'm thankful to the Pakistan Nuclear Society of Nuclear Medicine for giving me a chance to present this work. This work is very important because here was much more discussion about the resolution of the image, about the dose of the patient, about the production of the pharmaceutical. So I have tried my best to present whatever we did in the investigation of the internal dose of the patients in the different scans. So I will present it in the upcoming slides. For those who are from abroad and those who are not familiar with PNRA, I would like to introduce my organization, that Pakistan Nuclear Regulatory Authority has the mission to protect the workers and the public from the harmful effects of ionizing radiation. And we have different offices in Pakistan, and our task is to ensure that all the practices are according to the international standards that are set for the use of radiopharmaceuticals, as well as the other practices that are related with radiology and radiotherapy as well. We have headquarters that is located in Islamabad, and we have other regional offices. So if you see the regulations that are established, that are the laws that are available in Pakistan, according to the laws, no patient undergoes a radiological procedure unless prescribed by a medical professional. So this clearly describes the responsibility of the nuclear physicians as well as the oncologists who are responsible to prescribe the dose. The patient or the patient's legal authorized representative has been informed as appropriate of the expected benefits of the radiological procedure as well as the radiation risk. So the risk associated with any kind of scan or treatment is also important to investigate, because you are legally authorized to inform it to the other persons and share this information with the colleagues as well. Medical professionals are responsible for ensuring overall patient protection, so that's why it's also related with the internal dosimetry. So with these laws, I would like to tell you that these investigations are important, particularly the internal dosimetry that is given in the different laws, to see that what risks are associated with the doses. So why internal dosimetry is important? Because it is to assess the patient's dose as well as define guidance reference levels to permit the use of new radiopharmaceuticals, like Dr. Nadeem Lodi was investigating, was sharing his study. So it's important to undergo through these procedures to, if you are interested to apply on the patient scans. And this study is also to plan radionuclides dose, that is therapeutic dose, that was in theranostic procedures or the other procedures like the radioiodine. And it is also important to set the investigation levels and decide the discharge limits in case of iodine therapy and other things, and to determine the dose in the accidental situation and measure the dose due to radio contaminants or impurities, and develop the regulatory working guidelines procedures, and to define patient's discharge limit in other procedures as well. Like there are new radioisotopes that are used for the therapy, like actinium-225 and other radionuclides that are in the market for radiotherapy. So discharge limits can be defined with the investigation of internal dosimetry. So this is the basic of internal dosimetry. You know that when radioactive molecules or the radiopharmaceuticals are injected to the patients, different organs are become radioactive, and they are scanned with the gamma camera, and with this study we can understand that what is the dose to the source organ as well as source to the target organ, and from this we can investigate that what is the dose to the healthy tissue as well as to the target organs. So this is the very simple basic information. So if we are interested to investigate that how this study is carried out for those who are new in this field, I would like to say that the first three parameters are related with the physics, while the fourth parameter is related with the biology, that is the biokinetics of the patients, and this is more related with the investigation of the residence time, that is given with the tau as a symbol. So in this one we investigate that what is the dose to the target organ as well as to the source organ, and the residence time is calculated like as is given in this picture. You see that time versus the activity. In this procedure, we investigate that what is the flow of the activity at different times. So according to these equations, we can then see that how the activity is flowing from one organ to the others and vice versa. And because of this, we can understand the metabolism, distribution, uptake, and excretion of that activity from the body. And these are the simple equations that are used for the determination of S value, and S value is related with the radionuclide that is injected to the body, whether it is a gallium or yttrium-90 or any other radionuclide like technetium. And we calculate the dose, and there are different parameters that are used for calculations. So this is just the sharing of data, that is you see that here was lot of discussion, so I just included one slide last night. So for example, this is because of the dosimetry procedures that they are giving the comparison that if yttrium dotatate or lutetium dotatate is injected to the patient, how much dose is given to the is received by the different organs by the patient. For example, in the red marrow, you can compare the dose and kidneys as well as liver, so you can estimate the risk to the different organs. So nuclear physicians are definitely interested in the image, but they are also interested with the dose that is imparted to the different organs of the patient. So keeping in view the patient dose, the physicians are free to decide that which radionuclide is better for this investigation. For example, if you compare the injection of thallium-201 as with the technetium-99 system EV, you can see that 74 megabecquerel or 2 millicurie dose is given in thallium chloride, but overall the dose to the patient is received is 40 millisievert by the thyroid and 30 millisievert to the kidneys, whereas 740 megabecquerel dose is given to the patient in the technetium scan, and gallbladder receives only 29 millisievert while the kidneys receive 27 millisievert. Overall dose is 11.5 millisievert in thallium chloride and 6.7 millisievert respectively. The effective dose for thallium is 11.5 millisievert, whereas for technetium is 6.7 millisievert. So you see that it is almost half of that is given in the case of thallium. And in case of thallium scan, the thyroid was on risk, whereas in the technetium scan the dose is not received by the thyroid. So this is important to understand by the physicians to decide that which radioisotope should be used for different procedures. For example, in this study you see that they have carried out investigation with sodium iodide 131, 123 and technetium oxide and and FDG. So you can compare. Here is the comparison that shows clearly that how much dose is received in that procedure. So this information is usually very informative for the nuclear physicians to decide the use. So here from this slide I would like to share that what investigation we did carry out. So you see that there are different procedures that are used for the investigation of dose. For internal dosimetry, we can carry out studies on the animals, as well as we can also carry out the study with the help of scintillation camera, that is SPECT camera. I carried out in the studies with both procedures, but in the first one, that study was carried out in Brazil with the help of a professor. His lab was dedicated to carry out the animal studies, and in this study we injected the gold nanoparticles, as well as in the other study we injected graphene to the mouse, and then we investigated that how much dose was distributed in the different organs. For example, in one study I would like to share that gold nanoparticles were obtained through the nuclear reactions, and then those were injected in the mouse, and then it was observed that how much cell killing is over there that are the cancerous in the mouse. The cancer was grown in the mouse. In the studies that are carried out in Pakistan, we have these steps that were followed in Pakistan, and here you see that the first step was the patient preparation, and then patient was taken to the gamma cameras for scanning, and the scans were obtained, and those scans were then further region of interest were marked, and counts per pixel were calculated, and then according to the different models that are available in Olinda and IDEC dose, those models were used, and then those to the different organs were measured. For example, in case of neuroendocrine tumors that was carried out in Nuri, in this one the different scans were carried out. Like, see that here the first scan was at half an hour post injection, and then the second scan was around after 2 hours, and the third scan was after 4 hours, and so on. And from this study we observed that the dose to the different organs in for different scans was like this. These are the mean dose for example, you see that this is the study with Olinda, and that was the dose in the male patients, whereas there is also the dose for the female patients. And the organs that received the dose was liver, spleen, kidneys, bladder, and there was effective dose that is in millisievert per becquerel. So you see the results that these are the results that are given in comparison with the ICRP recommendations. You see that the procedures followed by the hospital are in agreement with the prescribed limits by ICRP. So in this procedure, the kidneys received 0.024 milligray dose per megabecquerel, whereas spleen received 0.029 milligray per megabecquerel. And likewise, the effective dose was 2 millisievert in this scan. In the case of DMSA studies, that is the renal scan study, again the same procedure was followed, and different scans were taken at different times. And after investigation, we came to know that the dose received by the patients, the 10 patients were scanned, and the dose received by them was well below the prescribed limit by the ICRP. So you see that here in this graph, the green are the calculations that were carried out with the help of Olinda, whereas blue are the doses that were calculated with the help of IDEC dose software. Likewise, in this scan, you can see that the activity versus the organs at risk, these are carried out over here, and they show that the dose received by kidneys was 69 microsievert per megabecquerel, whereas the liver was receiving 6 microsievert per megabecquerel. Likewise, in the case of tetraphosphamine, this study was carried out, and again different patients were scanned, and here I am going to share the scans of the patient that were taken, and see that the dose received by them is given in this table. So here the organs are brain, colon wall, gallbladder. Mostly the dose was received by the heart valve, kidneys, and the livers. These are the organs that received maximum dose, and these are the patient data, whereas this is the prescribed dose limit that is given in this table. The effective dose is also, the graph show that the prescribed dose is above, whereas the received dose is below the prescription of ICRP. Again, in case of sestamib, the patient scans are over here, and we carried out the study, and you see that the dose received by the patient is also below the prescribed limits. And this study is still not complete, and it is under still publication, and we will share it with you later on. And I am thankful to those who helped in this investigation, and particularly Dr. Shazia, who was at that time in charge in nuclear medicine department of Nuri. She supported me to carry out this study, and I am also thankful to Dr. Adnan. He also supports me. And the students were from Comsets University and UT Texla. I am thankful to everyone. Thank you for your patience.
Thanks a lot, Dr. Muhammad Shahid, for a presentation on dosimetry aspects of radiopharmaceuticals. If there is any question, please because we have very short time, just time for one quick question.
Very nice presentation. Do we have Olinda software or this type to be used for the dosimetry here in Pakistan?
Yes, Olinda software is available. I got it with the support of someone, but it's available with me, and you can get it and use it.
Okay, thank you very much.